on cancer and cancer-related issues. And this morning, we would like to begin with brain tumors. You would ask, why brain tumors? Because recently, more young people are recording cases of brain tumors than the older population. It's a concern, and the question is why, and that is among the things and the issues that we shall be addressing during this interview. Keep talking to us. KBC Channel 1 TV, that's our Facebook page. Samuel Njoroge is my Facebook account. At Sami1 Njoroge on Twitter. At KBC Channel 1 on Twitter too. Use the hashtag Good Morning Kenya. Right about now, I'd like to introduce my panelist this morning who will be helping us dissect this very issue. To my extreme left, I've got Dr. Wanyoike, a renowned neurosurgeon from Brain and Spine Rehabilitation Center right here in Nairobi, the first of its kind ever. Welcome to the program, sir.
Thank you.
And to my immediate left, I've got Peninah Mumbi, a brain tumor warrior. Karibu sana.
Thank you very
How are you
much.
doing?
I'm fine, thank you.
Gentleman, a lady, welcome to the program.
Thank you.
And I'd like to begin with you, Daktari.
Yes,
when
please.
someone talks of brain tumor, what exactly are they referring to?
Thank you very much. When we talk of a brain tumor, that is a swelling in the brain. It is we call it a space-occupying lesion that is in the brain. That means in a layman's language, there is a ball, like a swelling in the brain, and it is occupying space. Usually in the brain, the only things that you find in the head is the brain, the what you call the CSF, and the blood vessels, and the coverings. So anything that grows or that occupies a space within that the head is a brain tumor. That's the simplest meaning.
All right. That's,
Yes.
Go ahead.
But probably having said that, if you allow,
Yes,
is
go
that brain tumors mainly could be benign or the non-cancerous brain tumors, or the cancerous brain tumors. And the cancerous brain tumors are those that primarily arise from the brain itself, and those that come from other parts of the body into the brain. And I like the way you say this month is a tumor cancer awareness month, or tumor awareness month. And we are happy to start with the brain because that's the engine.
Yes.
And to show so that there's a relationship between the rest of the body and the brain tumors. So the ones that come from other parts of the body into the brain are called metastatic brain tumors, and that is part of the cancer spectrum of the brain tumors. However, it is the primary brain tumors, the ones that are non-cancerous, that arise from the coverings. Most of them arise from the coverings of the brain. So the ones that arise from the meninges, we call them meningiomas. And I'm sure most of our viewers have been told that you have a brain tumor, maybe a meningioma.
Yes.
There are other cells that cover the nerves that we call the Schwann cells. And so some of our viewers have been told that you have maybe CP angle tumor or posterior craniofossa tumor that is called a schwannoma. And because most of our viewers and this knowledge, so they will have found that one.
Yes.
But the world over, including Kenya, the most common is the tumors that arise from the cells of the brain themselves that are called the glial cells. And we call these gliomas. Now, it is now the gliomas that can develop from a low grade, which we call grade 1, to a high grade, which is called a grade 4.
Grade 4.
Now, the low grade can be treated as a benign tumor, but the high grade, that one is cancerous. So, and that, depending on the age, there are management options which we shall discuss later.
Absolutely.
Yes.
We shall discuss them later.
Yes.
But before I cross to Peninah, very quickly, are all tumors cancerous?
No, like I said,
Yes.
there are those that are non-cancerous, which are called benign.
Benign?
Brain tumors.
Yes.
And the benign brain tumors, the good thing with it is that once you remove the whole of it, good outcome.
Good outcome. Peninah, just tell us a little bit about yourself.
I'm Peninah Mumbi from Nyeri County. I'm doing my internship as a doctor in Bagati Hospital. I'm also a part-time lecturer in Kabete National Hospital. Yes. Kabete National Polytechnic, sorry.
Polytechnic.
Yes.
I have introduced you as a brain tumor warrior.
Yes, please.
Let's talk about the story behind you identifying as a brain tumor warrior.
It started when I was doing medical lab science in Kenyatta University. And then I started experiencing symptoms. Doctor will tell us the symptoms shortly.
Yes.
Mine was persistent headache that never ended with any form of treatment, any medication, any rest change, diet change. And then my ophthalmologist checked my eyes were okay. And then I was sent to Dr. Wanyoike. Yeah, and then when we did a CT and an MRI scan, that was it. There was a brain tumor in my head.
Oh.
And I want to say that was it was a life-changing experience. It went from desperate, dark, I became a doll again because I couldn't do anything.
Yeah.
And it went to a depressing situation. Then it started getting brighter, better, and here I am.
So
Yeah.
you sank, then you started rising
Yeah,
slowly.
exactly. Yes.
How did you process the news, Peninah?
It was one of the most difficult experience for me. But I like the way Dr. Wanyoike broke the news to me, that it was just a potato size mass in your brain that you have to remove. So I was like, what is this potato size mass? And but then I had to figure out, how do I tell my parents that this is it? And then all of us perceive that when you're directed to do a brain surgery especially, people think that's almost a death sentence, or you rather become a cabbage. Or yeah, you can't do anything
Right.
after that.
And in a bit, Peninah, we shall be discussing how exactly your parents took in this news and how you were able to integrate or reintegrate back into society as the Peninah we see today. Ordinarily, Dr. Wanyoike, we are told if it's breast cancer, you feel alarm, right? But with the brain, it's an organ that is a bit interior. How do you detect, or better yet, what are the signs and symptoms that you or anyone could be suffering from a brain tumor?
Thank you very much, Joroge. First of all, I'd like to tell our viewers, yes, the brain is very well protected in a casing we call the skull. And, in front of us, we have a phantom of that skull. Now, that enclosed space of the skull, it means that there's no room for anything else to grow. You can't feel anything. You can't feel like a blessed tumor. You can't feel a lump beyond the skull. So, but the brain is the one that controls the rest of the body. So how we wake up, how we walk, how we think. So one of the things that, you may have, that you have a brain tumor is, one is persistent headaches. And these headaches are mostly the headaches that will come in the morning. You may also get some feeling of nausea or even vomiting. And sometimes you get a relief when you vomit. When the pressure rise, you may have problems with the seeing. So, people will say, now, I cannot see properly, or that I can see one side and not the other one, or if it is children, you may find them, they are bumping into objects when they walk because they're not seeing properly.
Right.
Or you may have a tumor that may make your hearing not possible on one side, maybe on one ear, that you can't hear properly on one side, and headaches, and that sign of vomiting. You may also have problems with walking, you know, because, and especially if the tumor is at the back of the head, that controls how we walk. You may start seeing that you are walking like someone who is drunk. And people may ask you, why are you drunk most these days, or what is happening, you know. Or you may even note that one side of your body, either your hand or your leg, is starting to become weak, and you are hitting stones as you walk on one side, associated again with the headaches. So these are just some of the signs, and also, and especially for adults, or for first time people who have headaches, and you experience a shiza. A shiza is a conversion or an epileptic fit. That may also be the first sign that you have a brain tumor.
Yes.
And when you get all these signs, then it's good to have a chat with your doctor, with your physician, and see the way forward. They may, after that, they may examine you, what we call a neurological examination, or they may send you to a neurosurgeon or a center where there is someone who will be able to examine you and maybe send you for further tests to confirm whether you have a brain tumor or not.
Okay.
Yes, please.
Those being the signs and symptoms, could there be anything described as a cause of brain tumors?
Most brain tumors will grow from the cells that are within the brain, either from the coverings of the brain or from the cells that form from the brain itself. That is why I talked of meningiomas from the meninges and gliomas from the glial cells.
Yes.
So it is, you know, the cells do not follow the normal growth line. Cells are always dividing, some are dying. So the ones that are growing, if it, for some reason, doesn't follow, something happens, and it does not follow the normal growth curve,
Yes.
then it forms into a ball, which is what we call a tumor. There are some that may come for people who have had radiotherapy, for example. There may be changes, but in most cases, most of the tumors that we are talking about will grow the primary tumors. But again, tumors that come from other parts of the body, from the breast, from the lungs, from the colon,
Yes.
you know, that have grown primarily from those areas and come to the brain through the bloodstream. We call those metastatic brain tumors.
Yes.
So if you, the brain tumor may be the first sign that you have a tumor elsewhere, because if it is removed and it is shown that it is not a primary brain tumor, then you start looking for the primary source. So yes, there are those primary, and you can't feel them because they're inside.
Yes.
But those are the signs, and there are those, the metastatic, that yes, you have headaches, but you have a breast, or you have a lung tumor, or you have a colon tumor. So those ones can go into the brain, and then you start experiencing those signs.
All those signs.
Yes.
Peninah, earlier on, before I crossed to Dr.P, you mentioned that once you were referred to Dr. Wanyoike, he told you have a potato-sized,
Yes.
right?
Yeah.
Tumor in you, and he has to remove it.
Yeah.
How did you share that piece of news with your parents?
It was one of the difficult experiences I've ever had. My parents had already gone through so much, because for me to get this diagnosis, I had taken a long journey of seeing many doctors before this diagnosis was made. And first of all, I told my friend I considered committing suicide because this was, I was also a layman and I knew it was almost a death sentence. So I considered, why don't I commit suicide before this happens? But then, taking a second thought, I thought, this, on the positive side, is a better thing. It's being diagnosed will be removed, I'll continue with my life, and then things will be easy. So I took the courage and I went and told them. At that particular moment, I could just tell. When I told my mom, I could see tears trickling in her eyes. And then my dad, who was also sick at that particular point, he had a hip dislocation. He was emotionless. He was emotionless. And at that point, I told myself, I'm the one to encourage them. They are already going through so much, and I can't also make them their life worse than it already is. So I told them, this is better. It will be removed. I'll go back to school. I'll finish. Life will be easy. Yes.
Life will be easy.
I thought, because thinking about it positively, it will be removed, so I don't have symptoms, and then life will just continue. Yeah.
To what extent did it affect you as Mumbi? Maybe physical changes, psychological changes, interactions with the society, your friends, family. How did that change?
Okay. When I went to theatre a month after diagnosis, I came out with a life-changing experience. I had a stroke all over my body, and I could not, I told you at some point it was a dulling experience whereby you could not do anything. I was an adult, but I couldn't do anything. Not eat, not drink, not write the way I used to. I had to be taught these things again. And I could just tell by the people who came to visit me and see me, I could just tell that I was very sick because they could not hold their emotions. They just saw me and they started crying, and that's the time it hit me that I was very sick.
Right.
But then I always went back and told myself I have to be strong for myself, first of all, then for my parents, and then for everyone else who is in my circles. I deferred school for a whole year so that I could be able to recapitulate and gain back my strength. But then when I went back to school, I experienced something I've never experienced. Human beings are social beings, but that is the time I felt I experienced a lot of rejection from almost all my friends. Yeah.
You could no longer fit.
I could no longer fit because, as Doc said, sometimes you walk, because my tumor was at the back of my head, you could not walk strong. I always walked like a drunkard. So, in fact, I was nicknamed in class. That's that drunkard lady who comes to class. I was always in dark shades and always in a cape. So, yeah, people said things, and because they hurt me, and I was already feeling depressed, I decided to take an antisocial. I wanted to be alone. I just wanted to be alone.
But despite it all, here you are. And your story is inspiring Kenyans this morning. I believe that's the silver lining in the cloud you went through, and I'm really proud of you.
Thank you.
I am really, really proud of you. Dr.P, in the event someone is given a diagnosis and they're referred to you, and they come to the Brain and Spine Rehabilitation Center in Parklands, walk us through the process of handling a patient who's been referred to you.
Thank you, Jiroge, again. Peninah's story is, we've walked through, and it's a compelling story and an inspiring one, even to people who have brain tumors, and of late we are seeing more young people presenting with brain tumors. So when people come to us, the first thing, part of treatment, is to take them through what they have. To understand that, yes, you have a growth in the brain. Sometimes we lighten the moment by either referring to it as a potato, or a small pumpkin,
Yeah.
so that, you get to engage.
Yes.
People don't feel I'm talking of brain tumor, cancer, because that's what most people think. When you mention brain tumor, they think they have a cancer, and that's the end. So, and for most parents and for most patients, they go through a traumatic experience. A traumatic experience in terms of, and you find most of them will keep quiet. They don't even want to talk about it. They are crying. Most of them are crying or praying. But the first thing is to counsel. The counseling is the first part of treatment, even before you talk about surgery, so that a patient and the relative, they understand what they have, they understand the options that are available for treatment, and even at that time, you don't want to make them make a decision for which way you want the treatment. You have given the options, go and think about it. Maybe give some medicine for a week or two, and go and think about what we have talked about, and then come later. That is for people who have tumors, and they can be able to come to you. So counseling is the first.
Yes.
Then you give the options for treatment. Then you give them time. You give them treatment that you, first of all, medicine, that you allow them to think through it, and they come again. And then you say, we talked about the treatment, and now this, we can affirm what are the complications, what are the benefits, is it safe, is there a risk of the tumor recurring again? And most people will ask, will it recur in another part of the brain?
Yes.
Yes. And, people ask, how long, if it will recur, how long will it, and you reassure them, benign tumors all over the world, the statistics say that 13%, even if you remove all the brain tumor, there is a 13% chance of recurring after 5 years for the benign tumors.
And that is factual.
That's
statistics,
factual,
yes.
Statistics.
Yep.
But in 87, it will not recur. The malignant tumors have another, prognosis is that most of them will recur maybe in 2 years, between 8 months, if they are very cancerous, to 2 years. But there are other options. Like if you have a cancerous brain tumor and it is removed, and it is found to be from maybe grade 3 and 4, you have to talk about radiotherapy, and you have to talk about chemotherapy. And these are all treatments that are going to affect the patient. So even before we talk about surgery, so these are the things that we have to talk about so that the patient and the relatives, they are aware of what is ahead.
And they can understand what's going on.
Exactly.
And allow me to interject and
Yes,
ask this question. Earlier on, you mentioned that recently cases of brain tumors in the country are being recorded among young people. Is there a specific reason to this?
One, I think there's always the notion that lifestyle changes affect the growth of any tumor, whether it is cancers in the body, whether it is brain tumors. So there is the lifestyle change. Again, the fact that as a country we have invested in the government in diagnostic capability, so it is easier for someone who has a persistent headache, for example, to have a scan done in, say, in Kisumu, Nakuru, or Mombasa, and they are, as opposed, or even in a place like, Wanyoike, let's say, for example, because they have a capability for doing a scan. Most of the hospitals now, government hospitals, have that capability.
Yes.
So we are able now to diagnose these tumors earlier than before, which is good, because then you can offer the right treatment earlier in a safe manner, especially when they are referred to centers that perform these surgeries, and with a promise that if the tumor is benign, that the patient can still achieve what they had dreamt of before, their full potential. And that is exemplified, by Peninah and others.
Yes.
Because that is the aim of surgery for brain tumors, especially when they come to us.
When they come to you.
Yes.
So one thing that our viewers should note is that, one, it's a process.
It's a process.
It is a process. They have to be patient. It all begins with counseling, and then assessment and getting to know the grade at which the tumor is. Then you're able to recommend what kind of medical measures you will apply to deal with the situation. That's it so far. I'd like to cross to you, Peninah. You said that your social life changed. You had now to seclude yourself, became antisocial. When Peninah was alone, not interacting with the rest of the world, what was going through your mind? What was the stream of your consciousness at that particular moment?
It was in two phases. First phase was, I was just depressed. I just wanted to leave. I just wanted to go away. I just wanted to, this was too much already. But then the second phase was, there is hope. I've been given a second chance by God. So why am I stressing myself? So I opted to take the second chance, the second phase. And then I said, okay, fine, my friends have rejected me, maybe others will come, including Dr. Wanyoike, who is now my great friend and my great mentor. And I opted to see life in a different situation. Thanks to my friend, one of my friends who noticed that I was very depressed, and they recommended me a counselor. I did several sessions, and I was shown how to think positively about life. And then from then, my life became brighter, better, and it's at wherever it is right now. Yes.
Brighter, better, to the point that it is
now.
right now.
Yeah.
And when people hear of a brain surgery or anything to do with the brain, there is fear, there is withdrawal, there is that whole mentality of, okay, topic for another day, I can't deal with this right now, it's overwhelming. How did Peninah, a patient, digest and come to terms and accept that you need brain surgery and you need to undergo it rather?
I was doing medical lab science, and I knew the advantage of having an early diagnosis to a disease. Yes. So when I had mine diagnosed, I definitely was positive that it will be better. Life could easily change, that this tumor that I have, which I was diagnosed with, it will definitely be removed. Then I didn't know that after that, this is what will result, a stroke and facial palsy and eye complications, ear complications. But on the brighter side, I was early diagnosed, the tumor was removed, and after being rehabilitated for several years, because even now I am, I could get back to my feet and do the things I dreamt of doing. Yeah. So it was much accepting that this is good, it is an early diagnosis, it has been met, and then my life can be better after this treatment is done.
Okay.
Yeah.
Dr. How do you prepare a patient for a brain surgery?
Thank you very much. It's more like we sit in a counseling setup. You know, you don't want to have a barrier between the doctor and the patient when you are talking about this. You know,
Yes.
So you remove the table and so that you have one-on-one. And then you talk about it. You know, you address the fears that the patient have. Am I going to wake up? Am I going to be a cabbage? Am I going to, is this cancerous? Will I be able to go back to school? Will I be able to continue school? Should I defer my education? What will happen, And because most of the young people, they are concerned about finishing school, work, and, and life after that. Mm-hmm. For parents, they want to know, after you have had a child grow up and you told now that your child has a brain tumor, it is devastating for most, because you are thinking, is this the end, So the counseling is for both the patient and the parents. And sometimes you have to talk to the patient alone, sometimes with the parents, because sometimes you are not able
to balance.
Yes.
You
may find that maybe the parents are, one of them has more issues than the other one, mm-hmm. and the patient also has the issue. So, but you come to a level where you talk and you know the way forward. Mm-hmm. Now, having done that, is that you now take them through the process. If you have a phantom, you show them, for example, which part of the tumor the brain is. You may have to draw and show them where the tumor is. Mm-hmm. And because these are young people, they also read.
Yes.
Most of them will have looked at Dr. Google, and so they have their own set of questions. Uh-huh. And you talk in a way that is beneficial, that is an intelligent way, taking into account that you are explaining the factual as it is. What is likely to be affected, what is not likely to be affected. Most of them is that even when you plan, you tell them there are areas in the brain that you can plan where to go to approach the tumor so that the complications are reduced to a minimum. Even if you get complications, yes, some of these will recover. Mm-hmm. But having said that, there are also those tumors that are in difficult places, and you also have to bring that out from the onset, mm-hmm. so that whatever complications that arise, everyone, if the parents, the patient, they are prepared for that, and then they are positive in the way to approach the recovery process. Mm-hmm. Then when you have counseled and you have taken them through the process, then you book them for surgery.
For surgery.
Yes.
Right.
And the rest is technical, depending on where the tumor is. Mm-hmm. But you also tell them that when you wake up, you may wake up in an ICU. You may wake up not feeling one part of your body. You may have pipes coming from this this place and the other one. You will have machines making noise all over so that they don't get scared. Mm-hmm. You may, for example, have a machine breathing for you, so you wake up and you can't breathe for yourself. So you depending on where the tumor is, you prepare them. Some of them will say, I don't want to be given blood. Others don't have a problem. So those are challenges which you discuss prior now to surgery. Mm-hmm. And then after you do the surgery, then the recovery process. Yes. For most patients, they stay in hospital for between 5 days, others up to a week. And then they go home. But there's a process also, even for recovery. We like that once the acute phase is done, you do the rest of the recovery at home. So for most of the, if the tumor is in a delicate position, we advise some people, some of our clients, to defer maybe school for some time. But others, you can say, oh, well, this will take you maybe about 6 weeks to 2 months. So again, for full recovery, because you don't want them to go with their fresh wood back to school.
Yes.
Once you've gone through that process, then everyone is positive. The patient, the relatives, and even the recovery is positive. And then you also make them to understand that actually the outcome,
Yes.
what they want, the outcome depends on a positive attitude towards what they have, the surgery, and what they want to become.
In fact, in this particular case, given what you've just described, positive attitude is it's not an option, it's a necessity.
Yes.
You just need it for you to make sure that even as you engage through this process, you're able to have that positive energy going on around you. Just like Peninah, she kept it going and now she's right here. You were doing medical lab sciences at KU when you got this diagnosis.
Yes.
Talk about your journey so far. Where is Peninah now with your studies, with your life, with your dreams and all?
I deferred school for 1 year in KU, and then after recapitulating a bit, I went back to school and I finished. I worked for 1 year as a medical lab technician in a Bristol Hospital, which is in Embakasi. Then my dream grew even stronger, and I went to Dr. Wanyoike. I shared my ideas, and he told me, "Yeah, you're good to go. You can do medicine now. You are good to go." And I was like, "Oh, okay." So I went back to school. I did medicine. I finished. The journey was not easy because I had so many complications in my eyes. So far, I've had like 10 surgeries in my eyes. I've had plastic surgery. I've done because my symmetry is gone. They are trying to recover it. I've gone like for 2 surgeries, but that has not hindered me from following whatever I love, whatever is my dream.
Yes.
So I have finished campus. I'm a medical doctor intern now, doing in Bagati Hospital. So brain surgery or having this diagnosis is good, so that you're able to follow your dreams even after that. Were it not that I had the night diagnosis, maybe I would be a cabbage because maybe the diagnosis would have come late and I'm unable to recover. But then if the early diagnosis was made, I was treated, I was able to recover then, and then I was able to follow my dreams despite all the constraints. Yes.
You're able to, and all the best even as you continue achieving and conquering your dreams even in the future. Daktari, care at home is also another very important aspect to this. What's your advice to people watching us, to patients, when it comes to factors to consider while you are at home with this particular condition?
Thank you very much. First of all, let me reiterate, and that's the object of this discussion, is that early diagnosis and treatment, that's the hallmark towards the proper management of patients with brain tumors. Now, and it all starts from counseling to the treatment.
Yes.
Because when you do the counsel and the treatment in the hospital in the acute phase, then there's the home care part. Now, the home care part is you may not be able, for example, to walk from your bed, for example, but you may need a rehabilitation at home. So we have people that we call home care service providers. We have people who are, health providers that do diploma courses. They are called the healthcare not technicians. They are healthcare providers. Community providers that are usually found in most counties, and nurses. And those one would be given to, used to can give care at home, or somebody who has some medical knowledge in healthcare delivery. Now, when we ask that for patients who are in need, we ask that parents prepare the home setup. This patient may be using a wheelchair for some time before they really get up. So they may need that there's no staircase to climb. They may need sometimes to have some more or less like a HDU setup in one of the houses. But, you know, that is the middle and the upper market, but in upper group.
Yes.
For most of us in the village, it's mainly to understand that you need to give a supportive care to a person who has gone through brain tumor surgery. Both psychological, you have to understand when they are recovering, they are also recovering from depression, and, you know, so they're emotional. So there is a issue of anger management, and the relatives have got to understand that this person will have mood swings once in a while. They want things done now, or how they used to do them, but they can't do it because they are not able to jump up and down. So there are those issues that they will go through. So we have to understand from that aspect. And then we have physiotherapists, both at the community level and the hospital level, and we engage them that they can come to the home setup and help with mobilization. Now, what this does is that, and also the community support, which is important for when you need a friend of yours to come and walk with you around, or to come and spend time with you, or to come and just talk, just talk to you. That is very important even for people who are not sick, to support people who have gone through this process. But, and once that is done, then there is usually the reviews that you go to see the doctor once a while, depending on the prescribed timelines. There are medications that you need to take. Sometimes you may need to be assisted to take the medications. And of course, for younger people, and especially for children, some may need even to be taken to school, because if you can understand, if you can retain, if your memory is good, you may be, for example, have some weakness somewhere, but that does not stop your life. So we recommend that we work even with the teachers, that if you have a child or a young patient who has gone through the process, and they are going back to school is a recovery process by itself, because you can see, oh, now I can do the things that I wanted. So that helps us to recover. So we advise that we get that kind of an overall, an all-out community involvement for patients who have undergone this process for faster recovery.
Absolutely. Peninah, I'd like to come to you for a final word in this discussion. What would you like to tell Kenyans this morning? What was your message to even patients who are in the shoes that you were in, or have been where you have been? What's your message to them this morning? I believe this is your camera. You just look straight into it.
I want to tell you, people who are going through the same, or who have patients who are going through the same. I have gone through more than 15 surgeries. I have ear complications, I have eye complications, I have symmetry issues, but that has not stopped me. So if you have symptoms, please follow up with a neurosurgeon, and you are early diagnosed, and treatment will be instituted. And treatment is possible here in Kenya. You don't have to go outside the country. So thank to BSR, because they are offering this type of services. So if you have the symptoms, please go. And early diagnosis and treatment will be able to facilitate that you heal faster and you follow your dreams. Don't stop. Just follow your dreams.
Just follow.
Just follow your dreams.
Keep going.
Yeah, keep going. Keep on keeping on.
And especially in her case, it kept rising and rising and rising.
Yeah, in fact, it's rising even higher.
It's rising even higher.
I aim to be a neurosurgeon.
All the best.
Thank you.
Wish you all the best. Dr.P,
Yes.
21 years worth of experience in this field. Now as a neurosurgeon, with a center, the first of its kind in Kenya, that is the Brain and Spine Rehabilitation Center. What inspired you to go this direction, to deal with the brain and the spine?
Thank you very much. You know, I think this is a vision that I've had from early enough to be a neurosurgeon. And we have maintained the passion, and that is why we have the center. But let me tell our viewers that, you know, early diagnosis, I repeat again, early diagnosis and treatment is the mainstay of management of brain tumors. We have centers, you know, all county hospitals, for example, now have got the capability to do screening.
Right.
They have a CT scan or MRI. Right. So from wherever you are, in whichever part of the country, if you have any of the signs and symptoms that we have said, you can go and have a screening. And then if you have been found, if you are found to have a brain tumor, then your doctors will refer you to the right places near you. Now, that I think is the hallmark of treatment. Yes, I have had my time at Kenyatta National Hospital. In other public hospitals, we have given our time. But out of that, then I saw the need that we are sending people out of this country. The country is losing a lot of revenue. So why don't we complement the government's capacity by setting up our centers? And that is the vision behind the hospital that we have set up. BSR Hospital.
Thank you so much for coming.
Thank you very much.
And for shedding light on this particular matter. Peninah, thank you so much. Both of you, all the best in both your present and future endeavors. That has been Dr. Wanyoike and Peninah Mumbi. In fact, I should call her Dr. Peninah Mumbi,
yes,
because that is the field that she's in currently.
Yes.
Thank you for watching the show this morning. It's Cancer Awareness Month. Discussions of this nature shall continue to be held on this set this entire month. So check us out every Tuesday, 8 to 9. Health Tuesday it is, and we shall be discussing this and much, much more. For those who are asking more about, you know, brain tumors and brain cancers, check out BSR. I believe they're on Facebook. Their Facebook page is BSR Hospital. Check them out there, BSR Hospital as an account, and also BSR Hospital as a Facebook page. Check them out, and of course, we will be able to receive the assistance that you so desire. My name is Samuel Njoroge. Thank you for watching the show this morning. On behalf of my colleagues Safina Chieng, Martin Mwanje, and the entire production crew that has made this particular production a success, we say God bless you all abundantly and enjoy what is left of your Tuesday.